I'm Marita Shaw. I'm a senior data engineer, and I'm also the founder of Data Analytics Simplified, where I help people understand how data shows up in the real world and within their careers. In my previous post, we talked about security analytics, and I also introduced the framework where I describe how analytics essentially exists within every industry. Industries are vertical and analytics are horizontal. And in this industry, I want to talk about a very critical and popular industry. Let's get into healthcare. So let's talk about healthcare analytics. Healthcare analytics is essentially the ability to leverage data within the space of healthcare. What does that look like? Analyzing patient outcomes, tracking patient efficiency, tracking medication efficiency, spotting anomalies and gaps between provider care within different hospitals or agencies or regions, ensuring that those hospitals or agencies are adequately funded and staffed. That's leveraged by what? By data. As you can imagine, healthcare organizations generate an insane amount of data. And as we continue to move into a more digitized landscape, that need is going to naturally increase. And guess what? They depend on people that have a knowledge of data to be able to analyze and leverage that data so that they can make those informed decisions. And when we start thinking about the real life impact of analytics within the space of healthcare, it gets real. We're talking about ensuring that patients are receiving quality of care. We're getting into ensuring that these hospitals are adequately staffed and ensuring that they have funding to support their patients, or if these treatments are even effective for who we are providing this care for. It gets real. Healthcare analytics is actually where I've leveraged majority of my career. I was solely responsible for leveraging data within the largest behavioral health organization within this state. Later in my career, I also was responsible for ensuring data quality for the largest global insurance company globally, like one of the largest, the biggest, the largest. That's what I've been doing. And I understand firsthand how that work impacts the quality of care for the average person. Now, even though that environment was healthcare, those skills that I learned within that space can be taken anywhere from finance to cyber to marketing to customer service to legal. I can go anywhere and leverage data within those spaces because those data skills remain consistent. So, if we want to take it a step further, healthcare data is extremely sensitive. So, there has to be a level of compliancy and responsibility that someone that is navigating analytics within the space of healthcare, you have to adhere to. And that ability to understand the responsibility of those environments can also be taken elsewhere because that exposes you to compliance, that exposes you to data privacy, it exposes you to things that are prevalent within the space of data in its entirety. Now, another thing that I always talk about is domain knowledge. One thing that I specifically hone in on is that you do not have to solely reinvent yourself in order to be successful within the space of analytics. And I think that healthcare is an excellent example of that because typically within healthcare, that domain knowledge is going to leverage you and give you a little bit more oomph in comparison to someone who does not have it. What do I mean by that? If I'm already in the space of healthcare, I understand workflows, I understand data privacy, I understand medical terminology, I understand ICD-9 codes and all of these different codes and language that only exist within the space of healthcare. I'm good with it. I know it. So that domain knowledge and that understanding is going to leverage you into that space of healthcare analytics. I always say the analytic skills does not replace your domain knowledge, it enhances it. This is why I always encourage people to develop the proper skills that you need to navigate the space. Because whatever that domain industry is or domain knowledge, it's still valuable for you. I also think that people actually miss out on excellent opportunities by only focusing on titles as opposed to focusing on obtaining the skills and navigating deeper into the field that they're already in. So, bye, y'all. Hope this helps. I'm actually doing a full series about this. I've done security analytics, this is healthcare analytics. I have quite a few more. So, if this was interested to you, just follow me or whatever. Bye, y'all.